Good afternoon. Good afternoon, everyone, and thank you for joining the May Children's Caucus meeting. The topic for today's meeting is the importance of quality childcare and early childhood education to Ohio's economy. It's common sense that parents with young children need access to childcare to obtain and keep their jobs, which makes childcare providers a vital part of local and state economies. When parents can access childcare, they are more likely to enter the workforce and stay employed. Unfortunately, we have a lot of families in Ohio who can't afford quality childcare, and those who can often find themselves at the end of a very long waiting list. The strain of finding childcare while also working and supporting a family is all too familiar for many parents. Childcare is an area that impacts families, childcare providers, businesses, and other aspects of daily life. It affects how we work, when we work, and for many, the reason we work. Parents are often left to choose between leaving their job because their childcare costs are so high, or sending their children to a facility they don't entirely trust because they have no other options. In Ohio, fewer than 1 in 5 babies from families with low income have access to any early learning programs. Quality childcare and early education lay the foundation for future success for the children, families, and in turn the state. Today's panelists will discuss what Ohio should be doing to ensure the childcare infrastructure is accessible, affordable, and high quality, and the critical link between quality childcare and early education and a thriving economy. As we go through our presentations, if you have questions, please insert them into the question and answer piece. And then at the end of our presentations, we will open up the questions for legislators and then to the general audience. Our first panelist today is Katie Kelly. She is the CEO with Pre4Cle, a collective impact initiative working to expand access to high quality preschool to all 3- and 4-year-olds in the city of Cleveland, so that every child enters kindergarten ready to succeed. Katie, I will hand it off to you. Thank you.
Thanks so much. Thanks to everyone for joining us. So yes, as Kelly said, I am Executive Director of Pre4Cle, and wanted to share with you some of our experiences here in Cleveland, expanding access to high quality early learning, and also what we are focusing on in the budget. I'm not going to cover a lot of the overall system challenges because I think my very wonderful colleagues at Groundwork are going to be talking more about that. So I'm really going to focus on our experience in Cleveland, what we've done to expand early learning, and both the challenges and the successes that we've been able to accomplish. So Pre4Cle is a collective impact initiative. It is part of the Cleveland Plan for Transforming Schools, which is Cleveland's school transformation plan that was launched in 2012. And so when that plan was launched, there was a part of the plan that focused on kindergarten readiness as the first step in school success, and really the goal that all 3- and 4-year-olds in the city of Cleveland would have access to high quality preschool to advance kindergarten readiness. So Pre4Cle was created really as a collective impact initiative, bringing together the school district, the city, the county, our child care resource and referral organizations, Starting Point, and then a whole host of community partners, and of course, early learning providers themselves, to come together and think about how do we work together to expand access to high quality early learning experiences wherever a child attends preschool, and to make sure that we are working together to increase kindergarten readiness. So that's really Pre4Cle's role as that convener, as that collective impact organization, bringing all those groups together in Cleveland to focus on that mission. And just as sort of a framework for what our community collectively is putting together as far as our own resources towards early learning, it's about $25 million per year between the school district, the county, and then private philanthropic organizations. So we do have a pretty significant local investment to go along with this investments that we also advocate for. So on the next slide, this is again just our goal that every 3 and 4-year-old in Cleveland has access to high quality preschool. And then moving forward. So just to give you a picture of where we were when we started this work as Pre4Clean in 2014, about 50% of children were entering kindergarten either fully or partially prepared for kindergarten. So when we think about the Ohio's Kindergarten Readiness Assessment, we can look at those two categories. So only about 50% of children are reaching those benchmarks. 23% of Cleveland's children were enrolled in high quality preschool, so just about a quarter. But even with that, we knew that of the seats that existed, 20% were unfilled. So we had a supply problem and a demand problem. We have nearly enough high quality preschool seats for every child, but also the seats that we had were not being fully utilized. So we knew we needed to work on both of those challenges at once and really rapidly expand access to preschool while also making sure that families were aware of the options available to them, have the resources they need to connect to those options and enroll their children. And then because of that, we also had very unequal distribution across neighborhoods in Cleveland where we had a lot of neighborhoods that didn't have enough preschool, some that had too many options or just were oversaturated, I guess is a better way to put that. And so we really wanted to bring data to that challenge to make sure that all of our partners were thinking about where we needed preschool seats across the city. Okay, we can move on now. So really thinking about Cleveland's preschool goals then in light of all of those different starting sort of challenges when we started our work, we knew we needed to increase the number of high quality preschool seats across the city. We needed to connect families better to those high quality preschool opportunities. And then we also needed to remove barriers to preschool access. You know, connecting families and communicating with them is part of the challenge, but part of the challenge is, of course, cost, but also things like having enough full day versus part day slots, having slots in, you know, providers where parents want to send their children. You know, not all parents prefer one setting over another. So making sure that there's options for families, that they're in their neighborhood again. So transportation and just the logistics of getting to a preschool is not a barrier to access. Making sure that families who need, you know, a one place to send their infant and their 4-year-old can find places that serve multiple ages. So all of those things were really part of the picture that we looked at. And then also better community leadership and collaboration around creating these goals, working together, aligning our resources to meet these goals, and really aligning our community voice to focus on those set of priorities that we knew would make the biggest difference. So for the community, you know, just a quick look at what we do as Pre4Clean. We bring together, as I said, those partners in early learning, K-12, government, philanthropy, nonprofit and private sectors to work together on these early learning goals. That process helps to coordinate available resources so that we're being as strategic as possible with the resources that exist. We also work together to advocate for additional funding, and I would also say improved policies around early learning to set benchmarks and goals for our community around preschool access, and then to evaluate how we're doing on all of that work. We also do a lot of outreach for families. We have a very robust marketing campaign to families, utilizing many different forms of communication, digital marketing, social media, traditional media, radio, TV. So a lot of different ways of communicating with families. We have a set of messages that really focus on why preschool matters and also why quality matters and how to find quality preschool opportunities for their children. we, really focus on providing them with tools and resources to make it easier to navigate what is really a very complicated system with different programs and different eligibilities. So try to really make that more accessible to families and easier to navigate. And then, of course, we have a really wonderful resource in our community with Starting Point, our childcare resource and referral organization, who works one-on-one with families to connect them to different options, provides a lot of information and referral services for our community. So that's part of our partnership as well. And then also we provide staff who go directly into communities, go to events, host events, work with partners in the community to make sure that they're connecting directly with families. Next slide. And then for providers, our community has really focused on, again, expanding the number of high quality programs that exist in Cleveland. And that means new programs, but also helping existing programs increase their quality levels. So we have spent a lot of time and energy as a community over the past 10 years focusing on increasing the number of quality providers in the city of Cleveland. And I can talk about the results of that in a minute. And part of that is connecting providers to resources and information, professional development, technical assistance, networking with each other, and making sure that they have the resources and support they need. Higher education, CDA training, higher education connections. So all of that is an important part of that work. And then also providing individual supports to providers to help them increase their enrollment outreach to families, making sure that families are aware that they're there, that they're part of their community, and how to engage families in their program. So I also wanted to talk briefly too about the importance for us in really engaging in this system in all of the settings where children receive preschool. So this plan grew out of the Cleveland Metropolitan School District, and certainly the school district has put a lot of time and investment and resources and support into growing their own preschool program within the district. But I think, from the beginning, very wisely and collaboratively, the district understood that they could not serve every child in the city of Cleveland who needed preschool services. And that also, that families do need options. They do need these different parts of the system to really support the whole ecosystem of birth through 5 and all of the options that families need for young children. So, Pre-for-Cle and our collective impact effort has really been about raising up preschool opportunities, not only in the district, but within Head Start settings, childcare centers, and childcare home providers, really with that unifying focus of, are they 3 to 5 star rated and step up to quality, so that we know that there are quality early learning activities going on wherever a child attends. And so that's really been our focus in Cleveland, utilizing all of these systems, but really focusing on moving towards quality. You can see briefly there, the school district is investing $15 million per year of local levy funding. Cuyahoga County is also supporting a quality enhancement and scholarship model called UPK. So we do have local resources in the system as well. And, in as far as growing the number of high quality providers, since we started with 71 providers in 2014, sorry, that says 2000, I should say 2014. In 2014, we had 71 high quality preschool providers, and today we have 246. So that number has grown significantly since we started. And then just looking at our enrollment change over time, that bottom bar you see on the chart is the total number of preschool age children in Cleveland. So for us, that means 3, 4, and 5-year-olds not yet in kindergarten. So that's about 10,700 children. And you can see over time where we started. Next row up in 2014 was about 2,800 children. That enrollment steadily grew as we grew the number of high quality preschool opportunities and also our outreach to families. we saw enrollment significantly increase as well. So prior to the pandemic, in 2019, that was about a 72% increase in the number of children enrolled. Of course, COVID, set us back, but as you can see, we are rebounding and, steadily getting back to that pre-pandemic level. So I want to talk a little bit about our outcome data and really think about, what is the result of this work. But before I do that, I also wanted to talk briefly about how we partner with preschool providers here in Cleveland. So in addition to focusing on providers having access to Step Up to Quality and really reaching that 3 to 5 star level, we also offer a voluntary partnership with Pre-Berkeley with those providers who have reached the 3 to 5 star level to partner with us if they meet several additional requirements that we think are really critical to early learning. One is if they have maintained a 1 to 10 teacher to student ratio and a group size of 20 or lower in their preschool classrooms. There's also some additional staff education requirements that go beyond the Step Up to Quality requirements, and then ongoing evaluation and information sharing. So when I talk about in the next few slides, pre-Berkeley providers, that's really this group who have reached the high quality level and also these several additional requirements to partner with pre-Berkeley. So here's some of the results that we've seen in kindergarten readiness over the time that we've been tracking this work. So I know this is a lot to look at when you first glance, but let me break it down for you. So what you see here is children entering the Cleveland Metropolitan School District who are either in the approaching or demonstrating bands of the KRA. And so we really, we sort of track those bands together because we feel like those are the bands that represent a higher level of kindergarten readiness. Obviously, we would love to see all children in the demonstrating band, but even approaching children can have a significant amount of the readiness skills that we want them to have when they're entering kindergarten. So the sort of bottom green line that you see on the chart are children who have attended a 0 to 2 star rated program. So we really wanted to look at what is the impact of different quality levels on children entering kindergarten. So that bottom green is kind of what we would anticipate to see in the lowest unrated or lower levels of quality. You can see that children's kindergarten readiness was significantly lower. A step above from there is all children entering the Cleveland schools. So that number is, higher than unrated, but still, includes a lot of children who would not have had access to any sort of early learning opportunities, all the way to children who have these, higher quality. So that's sort of the median level of readiness. And then above that, those top 3 bars are children who had access to high quality preschool. The lowest line is children who were in high quality, so 3 to 5 star level preschool for any amount of time during those preschool years. The second line is children who were in high quality, but also partnering as one of those pre-Berkeley providers, meeting several of those additional sort of quality requirements. And then the top line is children who were in a pre-Berkeley provider setting, and we know that they attended that setting for 8 or more months. So duration really matters here too. So over time, obviously it's not a perfectly straight line, but we can see that definitely children who have access to any sort of high quality setting, but especially high quality settings with those additional pre-Berkeley requirements and who had at least 8 or more months in a setting scored significantly higher than their peers in unrated or lower quality settings year over year. And that climbed during the time that we were tracking these data. And it's almost a 20 percentile difference between unrated settings and the 8 or more pre-Berkeley setting pre-pandemic. Obviously, the pandemic had a huge impact on kindergarten readiness. As you can see, that gray line sort of marking where 2020 hit. We do not have any data from 2020. And the 2021 scores were significantly lower, as we would have expected with children who did not, much fewer children having access to these settings, and then all of the disruptions of COVID-19. So we do not yet have the fall of 2022 carry data. We anticipate having that very soon, so we can hopefully see those numbers start to rebound. Next slide. And this is also showing a different kind of impact. This is K-3 literacy in CMSD during the same time period. So you can see, again, not a straight line, but as we saw more children entering into high quality preschool settings, we saw what we would anticipate seeing is that K-3 literacy significantly increasing over those years. Next slide. So I just want to talk briefly about, how to think about scaling these sort of lessons from Cleveland and Pre-Berkeley on a state level, and how we think about these lessons as we do our advocacy statewide. And one is that I know that there's been a lot of sort of heated discussions over the past several years around step up to quality and the quality system. I guess just speaking from an early learning perspective, I know that a lot of the conversation has been that it's a lot of bureaucracy and it's a lot of paperwork. There is some paperwork involved for sure. But from an early learning perspective, I think you can see on the slides that we just went over, high quality settings do make a significant difference, especially for our children who are most in need of those high quality supports for kindergarten readiness. And so from our perspective, this is the theory we started with. We knew that quality mattered, and we have really seen the results of that consistently over 10 years of doing this work, that there is a very significant difference between children who are in unrated and lower quality settings and children who are in high quality settings, and also children who have at least 1 full year in those sites. So that is, the perspective that we come to this conversation with. It is a, step up to quality is really a system of professional development and support. And so that is what we would like to continue support for that kind of quality building in all early learning settings. Along with that, though, comes really the idea of needing to fund the true cost of providing those kind of services, for providing, teachers who are trained and qualified, for having really research-based curriculum and the training that goes along with making sure that teachers really understand how to utilize that curriculum and offer it to children in the way it's meant to be offered. Enriching environments, classroom environments, facilities, making sure that parents are engaged, all of those things, really are important parts of quality, and also have costs attached to them, especially when it comes to adequate compensation for teachers and staff. And so, that is part of the lesson, I think, from Cleveland, is that, really making sure that those settings are resourced in a way that allows them to be stable over time and maintain that level of quality. And then another thing is really, there's also been a conversation about focusing on the quality requirements that have proven outcomes for children. And, I think that our work really shows that there are some requirements potentially that are more important than others. And so really thinking about how do we focus that system on the quality requirements that do make the most impact for early learning, I think is also something that we think makes sense. Next slide. Other lessons, certainly cost remains a huge barrier for a lot of families, even with, Head Start and public schools offering preschool where they can. Many families, especially families who are above our child care eligibility level of currently 142%. I know we're moving hopefully to 160% in this budget that's being discussed right now. families up to 200% of poverty and beyond who don't qualify for any of those programs really struggle to afford childcare. And I'm sure my colleagues at Groundwork will talk more about this. So, we have consistently called for expanding eligibility to 200% of the federal poverty level. That is not part of the discussion for this budget, but is certainly, we think, should be part of the ongoing discussion on needs for childcare throughout the state. Also, just from our lesson learned on helping families understand Step Up to Quality, why quality matters, why preschool is important to their children, and offering potentially some funding for communication and family outreach to local communities are two things that we think could go a long way. So I just want to end with our priorities for House Bill 33 along the lines of everything that we just discussed. There are several recommendations from the governor's budget that were removed in the House version of the budget that we think are really critical. One is restoring the $150 million in ARPA funding for childcare scholarships. So this would be allowing our workers in critical occupations, including childcare workers themselves, allow them to have scholarships for their children to attend childcare up to 200% of the federal poverty level. So this would not be for everyone. It would only be for those people in critical occupations. But for the childcare field and some other fields like home health aides, this could be a really transformational investment in helping to support that workforce to stay in these settings. We have a lot of teachers who love this work and want to stay in these childcare settings, but just can't afford to do that because of the low wages. And so this would be one critical element that could really help to attract and retain those qualified teachers in the childcare field. We also would like to see the restoration of $10 million for early childhood mental health consultation, which provides professional development and coaching within childcare classrooms for behavioral health and mental health challenges that the children are experiencing. So this really is an investment that has a broad impact because it's impacting not just individual children, but whole classrooms of children. And there is so much need, especially coming out of COVID and all of the challenges that has presented to children and families. The need is really off the charts. This is beyond the ability to attract and retain staff. Behavioral health challenges in classrooms is the highest thing that we hear about. And, I know our field is just desperate for additional resources. So this is something that's greatly needed. We also are very supportive of the proposed Department of Children and Youth that would really bring together all of the early childhood funding at the state level into one department. This is something that I know I've been doing this work for 20 years. We've been talking about for that whole time and probably beyond that. This is something that would allow so much coordination and support and really better leveraging these programs together, making sure that children have a more unified experience who are part of these programs, and really allow us to be more efficient and effective in the way that we deliver not just early childhood services, but all of the services that would be part of this new department. So we really think the strategic support that this would provide to children's programming would be, again, transformational. And then I know that Groundwork will talk more about this, but really there are a number of other investments in home visiting and infant and toddler support that we think are critical just to maximize all of those investments, restore the governor's budget. There is never been a time where we've had greater need for early childhood support than we do now. And so really, thinking about how do we maximize that whole birth to 5 set of supports for children is so critical. So I'm going to stop there and turn it back over to Kelly, I think.
Thank you, Katie.
Sure.
And thank you for your presentation. That was very interesting, and I really love the information on the building partnerships and being able to scale that to a statewide level. Next up, we are going to hear from Amy Mead, Director of the Center for Early Learning, and Linan Gutierrez, the Chief Operating and Policy Officer with Groundwork Ohio. Groundwork Ohio is a research and advocacy organization focused specifically on the needs of young children. Amy, I think you are going to be first up, so I'm going to hand it off to you.
Thank you, Kelly, and thank you for including us in this conversation. My name is Amy Mead. I am the Director of the Center for Early Learning at Groundwork Ohio. As Kelly mentioned, I'm joined today with my colleague, Linan Gutierrez, Chief Operating Policy Officer. You'll hear a little bit from her later on in our presentation. Next slide. Just a little background, Groundwork Ohio is a committed nonpartisan public policy research and advocacy organization formed in 2004 that champions high quality early learning and healthy development strategies from the prenatal period to age 5 that lay a strong foundation for Ohio kids, families, and communities. We work hard to advance quality early childhood systems in Ohio by engaging, educating, and mobilizing diverse stakeholders and strategic partners to promote data-driven and evidence-based early childhood policies. Next slide. The success or failure of Ohio's education system is often categorized by investments or achievements that occur from kindergarten through graduation. However, data and research indicate that gaps occurring in K through 12 begin well before kindergarten, and the success of our education system and our state's current and future economy is also very much dependent on the investments made in children from birth to age 5. Understanding the importance of early childhood education for our future workforce in this state is crucial. After 2 years of extensive research, fact gathering, and input from child and family experts throughout the state, including families themselves, we proudly released the 2023 Early Childhood Data Dashboard earlier this year. It's a first of its kind tool incorporating more than 60 metrics across 6 domains, including early learning access, kindergarten readiness, poverty, prenatal care, well child visits, and more, spotlighting the immense challenges and broad inequities faced by families in our state. One key takeaway from our research reveals that Ohio kids are starting behind in kindergarten and staying behind. Research shows a strong connection between a child's readiness to enter kindergarten and their math and reading skills throughout their academic career. Next slide. Currently, 62.1% of Ohio kindergarteners are not demonstrating readiness for kindergarten, and children who are poor are more than 2 times less likely to demonstrate kindergarten readiness than their more affluent peers. That is 76.9% of poor kindergarteners are not demonstrating readiness. This gap in kindergarten readiness exists in suburban, Appalachian, rural, and urban counties, and even counties that perform relatively well overall see a gap of readiness for children from economic disadvantage. Even more alarming is that the readiness gap doesn't close. Nearly the same percentage of children who do not demonstrate readiness for kindergarten also do not demonstrate proficiency in 3rd grade reading or 8th grade math. Next slide. Early learning experiences set the foundation for school readiness and positive outcomes in school and life. The most significant period for brain development occurs from birth to age 5, and research shows that children who participate in quality early learning experiences have more developed language and social skills when entering kindergarten, are more likely to graduate from high school, and have good careers as adults. Investing in early learning from birth to age 5 prevents the costly learning gaps our colleagues in K through 12 struggles to close. The earlier we provide resources to educate people, the more money we save in the long term. And this return on investment includes folks being less likely to be arrested, less reliant on government programs, and more likely to be employed. Despite years of strong research in early childhood development, many Ohio children aren't ready to learn and continue to struggle throughout K through 12. Less than half of children ages 0 to 5 under 200% of the federal poverty level are able to access any state or federally funded childcare, preschool, or Head Start. Another key finding from our research is that babies carry the burden. Currently, less than 1 in 5 Ohio babies from families with low incomes have access to childcare, and nearly 40% of Ohioans live in areas considered a childcare desert, and this percentage increases to 60% for rural Ohioans. It's widely acknowledged that Ohio is facing a workforce crisis. Our state and industries are creating new jobs as they struggle to even maintain their current capacity. The challenge to find accessible and affordable childcare, which was made worse by the pandemic, is a serious problem, particularly in rural areas of Ohio, that is greatly impacting our workforce crisis. It is costing families and the state economy billions of dollars, worsening the labor shortage challenges for Ohio businesses and causing children to fall further behind. A recent poll by Public Ohio Opinion Strategies highlighted the difficulty parents have in accessing and affording childcare, which plays a foundational role in stabilizing families and businesses and rebuilding our economy. Nearly 70% of non-working or part-time working moms with children under the age of 5 in Ohio said they would go back to work or work more hours if they had access to childcare at a reasonable cost. The poll indicates that parents believe the pandemic has made it harder to both access and afford care for their children. More than 2/3 of Ohio moms said they would go back to work or work more hours if their child had access to high quality, affordable childcare. The average cost of childcare in Ohio is $10,000 and not around $10,000 for infant care. And then in Franklin County, the median yearly price of infant center-based care is a little over $14,000. That's nearly the same as the average annual tuition and fees at a public 4-year college or university. Despite the cost, many parents say they or someone they know are on a wait list for childcare, and more than 4 in 10 of those parents on a wait list said they have been on it for more than 6 months. And so you'll see the poll finding there. You can go to the next slide. The lack of investment in Ohio's young children in both childcare and preschool impacts Ohio's ability to attract new business investment across the state. Right now, Ohio parents are forced to choose between taking on full-time employment because they cannot afford the high cost of childcare, and Ohio's economy loses approximately $3.9 billion per year due to childcare issues. And one final poll finding is that 800,000 working parents have had to cut back their work hours. I'd like to now turn it over to Linan, who can share a little bit more about the work we're doing, but just want to reiterate that investing in strong early childhood systems is a necessary step to achieving our education outcomes, as well as contributing to a thriving economy.
Thanks, Amy, and thanks to CDF for putting our full poll in the chat. There's lots of great information in there that we didn't have time to share today, so please inviting you to view it on our website. So a little bit about what we're doing with this information, what we're doing with the advocacy story that we certainly share and have shared to many of you in the State House and among our stakeholders across the state. Is really mobilizing folks around the state budget, of course. And one really kind of development, certainly since I have been at Groundwork over the past 6 years, has been the deepening engagement with our business and community, so our employers. And what we are really finding is that this workforce case, this economic case for childcare, while it's been percolating for some time and for many of us is very intuitive, that it's really permeated employers and the beginning to really permeate executive level leadership for many of our employers in Ohio who are struggling to match qualified candidates with open positions that they have. And you saw on the slide before that, Amy mentioned over 800,000 working parents having to cut back hours. That's just an incredible and humbling number, knowing the immense need we have for workforce across the state. And of course, childcare is the workforce behind the workforce. And I'm sorry, go back, just if you go back to that business slide again, what you're seeing here is a signed letter from business communities across the state. So the Ohio Chamber of Commerce, Goldman Sachs 10,000 small businesses. So you've got large and small employers represented here, local communities and chambers of commerce, as well as large and mid-sized corporations all across the state who have signed on to support increased investments, specifically around Governor DeWine's proposals in this budget reflected in Substitute House Bill 33. Next slide. So in addition to cultivating those business employer advocates that have really rose up naturally and increasingly more since the pandemic as their own workforce has struggled to find care, so too has the engagement of the workforce behind the workforce, which is the childcare workforce. Our administrators, our teachers, and frontline professionals who are caring and educating young children every day. They make on average in the state of Ohio $12 an hour. And so they have been doing this work, really heroic work, and been very undervalued, certainly prior to the pandemic, but since the pandemic. And the workforce behind the workforce is more organized now than ever to communicate their needs and the importance of their role in our greater economic success in the future. This here is a letter from those workforce organizations, both statewide and local across the state, that have really supported increased investments in childcare. Both this business and workforce letter have been published in the Columbus Dispatch, and we've been sharing those broad and wide so that our policymakers and our communities know that there are leaders acting and willing to put their word and energy behind increased investments through state policy. Next slide. So that kind of three-legged stool, we have employers, we have the workforce behind the workforce, but the parental workforce has been one that has been much more engaged. Certainly you heard through our poll findings, what is really the story of parents and caregivers in our state, and the true real crisis that they and many of them we talk to folks every day who are having trouble with accessing the childcare they need, whether it's low-income families in rural Ohio, or even if it's some of our own staff members. We have all struggled with accessing childcare. And we've really mobilized parents and given them, helped them get a platform to be able to tell their own story as experts of their own lives. These are pictures of a few of the families who provided testimony in the House budget process, again, supporting those investments that the governor made. We know from our poll that 87% of parents favor increasing funding in the state for childcare and early learning programs. And I'll just share with you Rebecca Johnson's a little snippet of her story that she shared with the House. So she's the parent there in the middle. She has a baby Zoe. She has several older children as well. They live in Oberlin, Ohio. She was forced to quit her job as a result of the pandemic. She had a baby and has been desperately searching for infant care. She had the opportunity through her local JFS, our local Jobs and Family Services program, to become retrained and get her child development associate's degree, so a credential that would allow her to work in childcare there locally. And because she can't find access to infant care, she had to drop out of that program. So Rebecca was trying to be, as a parent, was trying to provide for her own family. Her husband makes $17 an hour. So she was trying to return to the workforce to be able to economically support their family. And She entered a qualifying education activity in order to do so. And the reason why she chose childcare is because she wanted to be part of the solution, recognizing how many of her fellow families and community members were struggling to find childcare. And she could not find infant care. And not only did she not find infant care, but because she couldn't find care and had to drop out of this program, her preschool age son also lost access to care. So now he's not getting that high quality early learning experience to put him on fair footing with his peers at the kindergarten level. So that's just a microcosm. It's one of the many, many, many stories of what's a really complex issue, but at the end of the day, really requires intentional state investment. Next slide, please. So we know we have many friends in our audience, both legislators and stakeholders listening in today, but if the case kind of Amy shared with you hasn't kind of spurred or sold you on the need for childcare, in addition to business leaders sharing their support, our workforce behind the workforce, what our parents are sharing with us, we've also found that 80% of voters favor increasing funding in the state for childcare and early learning programs. So this is an issue that voters are perceiving. If you, again, return to the poll findings, I find it really encouraging that voters who are not parents are still perceiving childcare and early learning as a priority for their community, especially as they see so many parents and caregivers struggling to support and provide for their families. Next slide. So Katie earlier shared their priorities for the state budget and House Bill 33. I will just kind of reiterate ours, some of which are very aligned, of course, which is not a surprise. The early childhood community has really come together, especially during the pandemic, to bring priority and awareness to the needs of the childcare system. And so our number one ask as the Senate is reviewing the budget is to restore the governor's proposed $150 million to establish childcare scholarships for critical occupations and other direct service professionals that include childcare professionals. So the governor had set aside some flexible state ARPA funds to provide some one-time scholarships over the next 2 years to provide childcare for critical occupations. So low-wage workers between 161% of the poverty level and 200%. So those that wouldn't otherwise qualify for publicly funded childcare, to be able to access childcare in these critical occupations that the governor and the state has recognized are in-demand workforces that are, most of which are serving our families, our communities, and some of our most vulnerable citizens. This money, we understand, would serve 12,000 scholarships, many of whom would be childcare professionals who, as you heard earlier, on average make $12 an hour. And so there's little to no incentive to going into childcare from a financial perspective. And this would allow a workforce incentive and be a tool in the toolkit to really being able to stabilize that workforce, where at least if you work in childcare, when you go to childcare, your child can go to the same place that you work and receive childcare. This may have eliminated that Rebecca Johnson, that family story I shared, have eliminated her struggle with returning to work. So the next piece that we're asking for is to restore the $10 million of cuts to support early childhood mental health consultants. So this is an investment in the Department of Mental Health and Addiction Services, but it is a direct support for our youngest children. Early childhood mental health consultants had initially been invested in our state to respond to the really alarming preschool and early childhood expulsion rates. So where young children, whether it's one or a couple of children in the classroom, are exhibiting some problematic behaviors or challenging behaviors, it can really alter the dynamic of the classroom. And if the professionals in the room don't have the skills to respond to the needs of that unique child, it can really certainly do a disservice to that child, but also the remainder of the classroom, and provide or create a lot more stress for that teacher, which ultimately can lead to problems being able to retain that professional in the classroom. So early childhood mental health consultants are credentialed professionals who really efficiently provide mental health services to childcare programs and children. They do not provide direct treatment, like a one-on-one treatment to a young child, but again, where a teacher in a classroom has a challenge with certainly overall classroom management, or they may have specific concerns around some of the children in the classroom, that mental health consultant can be a professional and come alongside them to help solve problems and give them the tools and the education they need to transform their classroom and really stabilize their classroom so that they can provide the care and education that they are intending to and overcome many of those challenging behaviors. We've heard across the board that these challenging behaviors are only increasing for our youngest children who are experiencing trauma at a really high rate. We know even infant maltreatment has increased since 2017. So our children are entering, whether it's the family home childcare program or a center-based childcare program, just as they're entering kindergarten, with lots of different behaviors that our professionals aren't prepared to support, especially those really underpaid childcare professionals in the field. The third is we're asking for the Senate to restore the nearly $20 million out for the state evidence-based home visiting program, Help Me Grow. So again, an early learning strategy in those first few years of life as brains are being built to support both mom or parent or caregiver and baby so that they can have that strong foundation and build that healthy development. We fund 3 models in the state of Ohio that really provide a strong curriculum and foundation for the relationship between mom and family and baby, which is really the foundation. Relationships are the foundation of all their development and how they learn and navigate the world, so that when they are engaged in childcare and preschool, and then of course kindergarten, they have developed those skills since birth, because we know children are growing and learning wherever they are. So we want to make sure there's positive environments in both the home and in early learning spaces. The last 3 priorities that we're really focused on is not to restore funds, but to maintain the good investments that the governor have put in and that the House have increased. So the first is we have $30 million in grant dollars to provide safe and developmentally appropriate childcare for infants and toddlers. Amy mentioned just how large the unmet need is. 55% of our low-income children 0 to 5 don't have access to early learning program, but when you just look at infants and toddlers, only 1 in 5 babies have access to an early learning program. And those are children that would already be eligible for these programs. So that $30 million in grant funds will be focused on supporting infant and toddler increased capacity in communities that need it most, including communities with high rates of infant mortality and Appalachian communities where they're at a much greater risk of being in the childcare desert. The number 5 here is also to maintain the increased funding for the state's preschool early childhood education grants. So we saw increased funding from the governor significantly to serve more preschool age children, 3 and 4-year-olds, both in community-based and school-based settings for preschool. And finally, as Katie had shared, to maintain the increase in eligibility for publicly funded childcare, moving from 142% to 162% of the federal poverty level. So I'm happy to answer any questions. I'm going to eyeball the questions in the chat, but I'll hand it back to Kelly as well. Great. I see there is a question from Debbie Brinkley. How do I use my voice to advocate for early learning programs? I live in Lucas County. So if you go to our website, and we'll have Amy put this in the chat as well, one of the ways you can act now and very quickly is to sign that parent letter, or share, if you are a professional in early learning setting, share that letter with the families that you serve in your community to show support. We'll be publishing the family letter with signatures on it later in June. So we'd love for you to sign on there, and we'd love for you to connect with us personally so we can help you get to know who your policymakers are and connect you with them so they can hear your stories. Debbie, thanks for the question. And we're going to be in Toledo this week, actually, so you should really reach out to me. We can maybe connect in person and figure out what you're doing up there.
Thank you, Lynanne, Amy, and Katie for your presentations. You presented us with a lot of great information and some action steps going forward, so that's always important. I would like to open up now to any legislators or legislative staff who are on the call who may have questions. You can come off mute and ask a question if you have any. I see there's one here from Senator Sykes's office. Do you know how many children and families would be able to qualify for the publicly funded childcare if the eligibility was at 200% versus the 142%? It's currently 160 in the proposed executive budget. So what would be that difference between 142 and 200?
I don't know the exact number right now. I mean, it's a little bit dynamic, obviously, because incomes fluctuate all the time across the state. So I don't have that exact number. I don't know if my colleagues from Groundwork might have a better sense.
No, Senator, we appreciate the question. We've done lots of projections previously, and the pandemic threw a bit of a tailspin into many of them in terms of uptake and utilization. And I will follow up. We'll follow up with your office to kind of get you the different components of that. But I know that the department would be in a fantastic position to be able to answer that question. I know that they've looked at that and would have a better, a more accurate representation of uptake as well. I do think it's worth saying, since you asked about that, is that just our kind of shared urgency around the early childhood workforce and the ability to really stabilize the system so we can serve more children. All of these investments in early learning are reliant on the adults that are in the room. And if they're not in the room, they're not able, the children are not getting served. So we appreciate your support to help stabilize them in this budget cycle.
Are there any other questions from legislative offices or legislators themselves that are on the call? There is one question here, Katie, that came in during your presentation that was asking about the rating system and the definition of high quality.
Yeah, I mean, so when we talk about high quality, we're really talking about 3 to 5 stars on the Step Up to Quality rating scale, and I think pretty broadly across the state, that's the definition of high quality. So, you know, what that means for folks who aren't as familiar with that is that, you know, early learning providers have met a certain set of benchmarks that are in a number of different areas, but when they reach a 3-star, you know, we know that they're implementing a research-based early learning curriculum across all of their different age levels, and where the teachers really, not only are they implementing it, the teachers really deeply understand it, that they have, you know, really been trained to utilize it and implement it in a way that's effective for children. So that's a huge part of it. Also, the teachers themselves, their training and education and their knowledge of early learning development through their training and education is part of that. How providers engage families, having a family engagement plan, having a transition to kindergarten plan for preschoolers. All, those are all components. There's more than that too, but really components of, different facets of quality that we know that providers have at that 3 to 5 star level. So that's really what we're talking about when we talk about high quality.
Thank you. There was another question. Do we have any idea of how much we lose in revenue due to the childcare crisis? How many families are, I think in this case, it's usually women who leave the workforce in these kind of cases, but what's the effect of that?
Go ahead, Amy.
I shared earlier, it costs Ohio's economy $3.9 billion in losses due to the childcare crisis, with many families, especially women, choosing not to enter the workforce because they can't find affordable care, or having many problems with childcare in their area.
And that number is just for infant and toddler care. So just for babies and toddlers. Certainly we continue to see that with preschool age children, and as I'm finding out myself, after school care for our kindergartners and school age children. It does not go away.
Well, we're right at the top of the hour, so I want to thank everyone, both listening to the call and of course our presenters for sharing all of their expertise with us. We'll send out a copy of this webinar along with all of the resources that were shared in the chat. And if you want to learn more about the Legislative Caucus, or you have any questions about what was presented today, please feel free to reach out to me, Kelly Visral, at kvisralchildrensdefense.org. And we will see you in June for our next webinar. Thank you very much for joining.
Thanks, Kelly.
Thanks, Kelly.
Bye.